One of the most common procedures as we all get older are these knee replacement, hip replacements, and here to talk about it is Dr. Michael Crovetti. And a little bit later on the show, Rich and Tully does impersonation. He's going to come out here and impersonate you. So be careful what you say.
They get him a haircut.
Yeah, yeah. I mean, he's able to do it without even changing hair and face, and just picks up mannerisms and speech inflections. But you've been an innovator in orthopedics. I mean, you've for years have been the orthopedic surgeon to the stars. You've handled a lot of famous people. People come from all over the world to come to the Crovetti Center to have surgery. But I mean, you keep innovating. But now you've taken the next step, right? I mean, you drive around town. You have some billboards touting your surgical suites.
Correct.
Recovery suites.
Right.
What exactly are they?
Well, I learned the billboards from you. I'd like to thank you for the advice.
Yeah, the billboard companies should thank me.
He's trying to put myself somewhere near where you are. I know it'd be a good spot. These recovery suites are the next step in joint replacement. So these joint replacements, hip and knee replacements, first thing you're going to think is big, right? Big surgery, 3 hours, big recovery, weeks that you're going to be laid up.
Now, how many days typically is somebody in the hospital after, let's say, a knee replacement?
Used to be 5 to 7. Now it's 2 to 3. So now it's 2 to 3. And the key word there is hospital. Usually they're in a hospital. And that's kind of where we've made the change in joint replacement. So we took patients that were younger, healthier, active, and we said, you know what do you need to be in a hospital for to have this joint replacement? We're going to make a minimally invasive approach. We're going to have very little blood loss. Surgery is going to be less than an hour. And you're going to walk 3 hours after your joint replacement.
So is that part of the protocol now? You want to get people up and walking and moving after a knee or hip replacement?
And the thing everybody's afraid of, right? Blood clots.
Right.
Everybody's afraid of the lungs and heart, all these different things that happen after joint replacement. Well, they all go away if you just get up and walk.
If you move. It's good for you to move, right? I mean, the body in motion is a good thing, especially when it comes to clotting.
Not much you can achieve without moving. You got it. Exactly.
Which is so different than what it was, 30 years ago.
10 years ago. I mean, who thought we'd be doing joint replacements in a surgery center? Who thought we'd be treating people without catheters in their bladder, without antibiotics and all these tubes sticking out of them? And we do.
So you do a joint replacement without a catheter?
Right.
So, okay, surgery's finished.
Yeah.
Person gets, I guess, wheeled down to your recovery suite.
Gets sent home in their sweatpants. Then they go down to the recovery suite.
From the anesthesia and able to get up and move.
In the recovery room.
Right.
Part of the requirement is that they get up and walk in the recovery room, because then they're ready to go out to their car.
Right.
So they shoot out the back, throw their sweats on, shoot out the back, and then we readmit them in what I call my living room. So they can go home to their own living room. They can go to a hotel, which is being done in the country, scary. Or they can come down and stay in my living room, let us take care of them for a couple of days.
And how does that work? They come down to your living room, and you have nurses, you have housekeeping, you have all the services, you must have food. I mean, you have a kitchen or something at your facility?
We do. We have a cafe, so we feed them breakfast and lunch, and then we cater dinner.
Right.
So it's kind of fun. They get to pick from 5 different restaurants, and it's a lot of fun to let them go through and order these things. You walk through there, it smells like you're in the best Italian restaurant in town.
And what is the cost of the difference of cost between doing it that way or staying in a hospital?
The hospital has a lot of costs, right? They have an emergency room, an x-ray department. They have all kinds of different patient populations. So we're able to save the payers about 18 to 22% per case. So if it were $25,000, we can do it for 20. If it was 20, we do it for 16. So we save them about 20%. And I think it's great for healthcare. We minimize the complications, and we save them some money.
And does that work with somebody who has Medicare as well?
That's my biggest challenge right now. There's so many healthy Medicare folks out there, and we have been working with them. In fact, we just applied for a new program that gives us a grant to study outpatient joint replacement in the Medicare population. So just applied for that. In fact, finished it this last night.
Wow. Talk to me about the actual procedure today with a knee replacement. And look, you hit a certain age, everybody's knees hurt, right? I mean, so let's start with, how do you know if you're a candidate or if you even need a knee replacement?
Well, obviously it all starts with pain. And usually most people, they'll come in and we know they have a little bit of arthritis. Some of them come in and all their cartilage is gone. They have bone-on-bone arthritis. But they're tough. They're out playing golf. They're out. They're not stopping to have a knee replacement. They're on the go, right? So I always tell them, they always say to me, when am I going to need this knee replacement? I said, you'll tell me. I'll see you when you're ready. And
When
sure
they
enough,
when they can't stand it anymore.
right, it'll be the 16th hole. I couldn't make the 18th. 14th hole, couldn't make the 16th.
Right.
You know, things they used to do, they're not doing. And we try conservative treatment, right? Put some injections in, try some therapy, try something. But then the day comes when they just have to have it done.
Does it eventually come for everybody?
Absolutely not. In fact, it's the most amazing thing. You could see somebody overweight that doesn't, you know, plays a lot of Xbox, and they got terrible knees. You could see a young, healthy person who runs marathons, they've got terrible knees. If we could figure that out, I think we could get rid of arthritis.
Yeah, I mean, I was going to ask you that. I mean, what tips would you give somebody to prevent a knee surgery or a hip surgery replacement?
Well, you know, obviously staying healthy, staying active, I mean, those are things you would think would lead to arthritis, but they actually don't. They actually don't. But motion is king. What's the first thing you said when we sat down? Motion, right? Getting up, getting going. Any joint or arthritic joint is only as painful as it is stiff. So you can have a terrible hip, but you'd be doing great because you're riding a stationary bike every day. So as soon as it gets stiff enough, can't put your shoes on, can't scrub your feet, then typically we'll see them for a hip replacement.
Well, and once you do a knee replacement, and assuming that everything goes well, if you know, 10 years earlier, let's call it, you were at a 1 to 10, you were at a 10. Hey, you had no pain, your knee worked perfectly. Then, you know, it became painful. You went down, you say you were a 2 or a 3 as far as functionality with your knee. Now you get the replacement. What can you get back to a 10?
You know, you can. Interesting. Everybody's concerned about, they don't want to do it because their life's going to be over, or they're not going to be able to do something. I had a guy come in the other day. He's 72, did both of his knees in 07, I think. He just came in to tell me he just did his 1,000th ski run. You know what I mean? So getting back to those things, when you do a knee replacement, we don't replace the knee. It's such a terrible term. We actually resurface the knee. You know, it's really your knee, your ligaments, your muscles, your tendons. We just put in new coverings because the old ones are rusty. And that's really what a knee replacement is. So it should be more of a resurfacing than a replacement.
And what is the rehab period after the surgery until you're up and, you know, recovering 100%?
100% is hard to tell what's 100% for everybody, right? So getting up and driving and doing things at about 3 to 4 weeks. By 6 weeks, I let my patients go back to, let's say they like to bowl or golf, or they like to play pickleball, or you know, any one of those fun games. We'll get them back about 6 weeks.
And how about if you're jogging or biking?
There's no jogging. Biking, we bike like a crazy person. We love people to get on a bicycle and ride. Had a guy ride his bike from San Diego to New York after a hip replacement. Fantastic, right? But knees, we don't want to jog because we want that knee to last as long as possible. And that new piece of plastic we put in there is like treads on a tire. Might be the best tires you've ever bought for your car, but you drive that car enough, you're going to wear it out. So jogging is a little bit out. Walking is great. Swimming, biking, elliptical, you name it, those things are great.
And what is the lifespan of the knee?
We don't know. We know that the old ones were 15 to 20 year solutions. I saw a guy the other day had one put in 95. Okay, so his was 95, he was in his 30s. He's not ready for new ones yet. You know, this is old technology, old plastic, because the plastic's the key. So we don't know, but we know what we have today is better than we had 5 years ago.
Now, with elderly people, you know, it used to be if somebody fell and broke a hip, you know, it was almost a death sentence, right? It's not that way anymore?
Not at all. Not at all. Everything is about getting patients up and walking. You know, they used to put screws in and plates and different things, and the construct wasn't itself inherently stable, so we had to protect them. Now our constructs that we use, different types of metals and rods and things, now we're all about getting them up. So you can pretty much bet within 24 hours of breaking your hip, God forbid, you're going to be walking down that hall.
Amazing. 24 hours.
Whether you like it or not. You're getting up and you're moving because we're not going to deal with the pulmonary complications and all these things. That's what people died of, right?
Right. And infections, pneumonia.
Right. Laying around.
Yeah.
Laying around.
Yeah.
I think it's a curse laying around.
You know, it's you know, one of the things that all hospitals are battling now are infection rates. You know, it's sad, and here in Las Vegas we have one of the highest infection rates in hospitals, if anywhere in the country. There's a lot of sick people in hospitals. If you're going to a recovery suite instead of a hospital, I assume, since there's not somebody down the hall with pneumonia and staph infection and something like that, that it's a different ball game. There's far less infections.
Totally different ballgame. And you know, I don't think you ever can eliminate infection because the infection's in the community too. It's not just in the hospital, it's in the community. And our hospitals are doing the best they can in light of the last few years. Really, I'm there every week. But I will tell you what we have done is we've eliminated the exposure. So we've eliminated the exposure. Our nurses are our nurses, they don't come from the hospital. Our staff is our staff, they don't come from the hospital. I'm a nut about cleanliness and sterility, so I think we've eliminated the exposure, which has to turn out to less rates, right? I mean, it has to turn out to less infection rates.
Yeah. So, I mean, somebody's in a recovery suite, can they have a spouse or somebody stay with them?
As a matter of fact,
do you have sleepovers there?
As a matter of fact, one of the coolest things we do is that we actually take care of a family member and the patient. So what happens is, by day 1 or day 2, that patient becomes the nurse. They literally take over the care. They change the dressing, they take them to the bathroom, they shower them because we've got these private showers. The family takes over. Our phone calls after people are home have dropped almost to 0 because we're educating the whole time they're there.
Right, because what to do post-surgery is important.
Everybody, especially hip replacements, everybody's worried about, is it going to pop out? Is it, can I get out of bed? Can I cross my leg like this? Well, we spend 3 days giving you the confidence you can do all those things in a very, very short order.
You have an interesting background. You're very athletic, big football guy. Is that what drove you into orthopedics?
It is. Kind of in the middle of the night, we were playing Widener. You remember, you're back.
I went to law school in Widener.
Okay, so we're playing Widener one night. It's my junior year, and I roll out to throw a pass. We're down 10-7, driving down the 30-yard line, and I step in a hole, break my ankle. Go to the sidelines, they make a cast out of tape, go back in. And
they sent you back in the game.
So well, hey, listen, minute and 30 seconds left, down by 3, we're going for it, right? So go back and hobble out, drop a pass off to the fullback, bounces off his chest, pops in the air, lose the game. That night, I really wanted to meet this girl, so I had her take me to the ER in the middle of the night to get my ankle fixed. And sure enough, the doctor that came in, we hit it off. And he takes me, he says, why don't you come down to my office and see what I do? I said, all right, I'll go. So I go down to the office, takes me to the operating room, and his partner's doing a hip replacement. Takes the ball of the hip off and tosses it to me. Almost passed out, right? I'm a junior in college. Almost fell apart, but I knew that day, and to this day, my favorite procedure, a hip replacement. And I tossed the ball.
So you hadn't planned on going to medical school up until that point?
That was when I made the commitment. Unfortunately, it was my junior year, so I just worked through the summers and everything to get all the classes done, and that's when I really made the commitment. I'm a quarterback in college football. I'm for sure going to the pros. So what do I need to study for? Then I figured out how slow I was, and I figured that real quick.
Wow. Well, at least you made the switch, huh?
We did make a good switch. When I look back, I'm probably walking a little better for making that switch.
Yeah. How are your knees and hips?
Good. Great.
How's that ankle?
I was telling somebody a story yesterday. You know, it still it gives me something to think about here and there, for sure, for sure. Gives me an excuse not to go play hoops with my son when he's trying to kick my butt.
What will be the next innovation with knee replacements that you see coming in the future?
That's a great question, because I just literally am working on something in Chicago in July to design a sports knee. So we're working with a group of surgeons around the country to design a new knee replacement. And I think it's going to be, if I could use the word sexier, it's going to be more like your knee. It's going to function more like your knee. It's going to take this resurfacing to a new level. Some of the different metals we're going to use in ceramics are going to make it more durable. So maybe there's a day that a guy goes out and plays some real hard tennis on a nice new knee replacement and doesn't worry about it failing. So I think that's what's coming.
And how about hips? Anything coming down the pipeline there?
The greatest surgery ever is a hip replacement. And there's, right now, as far as our ceramics and our plastics, we've got, I'm using a hip that we put down the thigh bone that's been around for 23 years. That's how good it is. And we're seeing failure rates less than 1% on that hip. So we don't know why they're going to fail. You saw that metal thing. With the, with the metal hips. And the metal debris. So we've gone to now, it forced us to make great plastics and better ceramics. It forced us to, because the metals didn't work out so good.
You know, jogging post knee replacement's a no-no. What about after a hip replacement?
Isn't that funny, Bo Jacks? You think back, we have everybody playing baseball and running on these. Listen, these are tough to run on, but you run better than you ever ran. You know what I mean? But again, same thing, durability, how long we want it to last. It's not going to break because you're running. I got guys racing motorcycles. I got them doing all kinds of crazy things with hip replacements. And really, again, we just want them to last longer.
It's just amazing. Just how incredible how far these surgeries have come in such a short period of time, and how devastating they used to be compared to how almost routine they are.
They are. You know, the fastest growing segment of hip and knee replacement in this country is 45 to 65, which is the hardest thing to believe. In fact, they think by 2019, that's going to even double and triple.
Right. Keeps getting younger.
Yeah.
I wanted to ask you about, because we were talking before the show about medical tourism here in Southern Nevada. We seem to be ideally situated to offer really good medical facilities and treatment and attract tourism at the same time.
That's the coolest thing, because we're saying, and actually I told you I was at dinner last night with some of the folks from LBCBA and really working on this medical tourism project. They're committed. You know, the city is committed.
Right.
It's committed to the credibility that we need to make it, you know, a viable option for patients to come from all over. But how hard would this be? Pack up the family, head to Vegas, get your hip or knee replacement, and we're seeing people. You know, we have a pipeline with Alaska. I'm doing Alaska patients over and over again. You know, I did have a patient from China, which was really neat. His family came over, and breaking through the language barrier was fun. He did great. We sent him back in a couple of weeks. It was a pretty amazing experience for both of us. But that great stuff is here, and people just need to see it.
Right.
We're going to get it
Combine
out.
a little treatment with little vacation, little gambling, huh?
Yeah, a little win, a little treatment.
Casinos, I'm sure, in favor of it.
Little
right?
knee replacement, little win, little encore. Yeah, exactly. I think it'll work out well for everybody involved.
Yeah, I personally would take my luck and use it in your surgical suite instead of in the casino.
You and me both.
I don't want to use up too much of it at one time.
That's very true.
You know,
very true.
Dr. Michael Crovetti, thank you so much. You can visit him at CrovettiOrtho.com. He's got a state-of-the-art recovery suites. He uses state-of-the-art and creates state-of-the-art procedures for knee, hip replacements, as well as other things. My family members have seen it for other problems, too.